Thank you very much. Thank you, Joe. And I'm going to share my screen. And incidentally, I've had a little bit of a problem with my microphone and system. So if suddenly I glitch out, I may reboot, and I'll be back in about 3 minutes once I get my system rebooted. It seems to fix it. In any event, Stamford State of the City, this one's a little bit different because it's less about the state of the city going forward and more about what we've been through. I'm really going to talk more about the, actually, let me do this. Here we go. I think that'll be a little better, and I hope most of you can see it. I'm going to narrow it just a little bit. I think that might help for some. Any event, so I'm going to talk mostly about COVID-19 in Stamford and a little bit about our economy and the city budget and the implications for that. And I would start by saying, unless you lived through the 1918 pandemic, I don't think anybody could have ever known what this was like. Certainly our country and our planet has faced challenges of that order of magnitude in World War II, and some might argue the Cold War and stuff like that. But to put it simply, this is one of the most significant events of our lifetime. These numbers change daily, but there's almost 1 million fatalities worldwide and climbing. There's almost 200,000 fatalities in the US, and I think that any healthcare professional would project that that will be true by next week. There are reportedly 4,480 fatalities in Connecticut and 202 reported fatalities in Stamford. And before I go on, and I might mention this later, I think that the reported fatalities in Connecticut are low. There are situations, and I think it happened more in some of the other major urban top 5 cities, I'll say Bridgeport or Hartford, than it happened in Stamford. But I believe that the ambulance gets called to go to somebody's residence and an elderly person has died of unexplained causes, and it didn't get reported as COVID, but the number of fatalities that are occurring in some municipalities across the nation are higher than the difference between normal plus COVID. So I think it's actually being underreported. I obviously can't prove that. We have had 200 reported fatalities in Stamford, specifically identified, and I think that's mostly accurate. And I think you all know it's highly contagious. A significant proportion of the people with COVID-19 have no symptoms, and yet they're spreading the disease. And particularly in New York City, there was a significant spread occurred before a full awareness of the extent of the disease. And I think the New York Times basically talked about how New York City was an epicenter that actually was, until these things in the South started happening, was in fact the major spreading point for much of the nation. No vaccine or no cure, although the treatments for those with severe COVID infections have improved, and we can see that in dropping fatality rates relative to the infections, and obviously limited access to testing and PPE as the crisis unfolded. And on top of it all now, we've got what I call the coronavirus recession, the greatest and most rapid increase in unemployment since the Great Depression. And so we'll talk a little bit about what here happened in Stamford. We actually took our first actions on March 6th. I had actually been debating this about, did we even have the power to do this? I was going to restrict entry into the government center and other buildings, the police station in particular, for the public, unless there was hand sanitizing, and we put up all sorts of signs in the bathrooms and all sorts of stuff. That was on March 6th, and at that time, there had not been a single case in the state of Connecticut. So that's when we first announced something, and I will tell you, we got some pushback, not very much. I actually had a security guard there reminding of everybody that they had to hand sanitize coming in. We had a police officer there as well, but not right at the, just kind of in the background in case we had that sort of conflict. 2 days later, we had the first positive case in Connecticut in Wilton. 4 days later, Lamont declared a public health emergency. We started announcing changes in our things that were beyond just entering the government center, minimizing non-mandatory meetings and out-of-state travel restricted for city employees. The senior center canceled its activities. Stamford Hospital reported its first symptomatic patient, which wasn't from Stamford. And just to get the context, I was presenting the already submitted budget to the Board of Finance and the Board of Representatives. Even as this was unfolding, we had a budget based upon the world 2 months earlier. Our first case in Stamford was on March 11th, and that actually wasn't in Stamford. It was a person flying from Italy who got off the plane at JFK sick, and her family transplanted her directly to the hospital. So even though that was our first case, it really wasn't in the community. The community was never exposed. But when you look at the chart, you know, basically 4 weeks later, after a case that really wasn't in Stamford, we'd gone from 1 case to 1,000 cases in Stamford in 4 weeks. That is, you hear this word exponential growth. That actually in biologic and mathematical terms, that's something very specific. It's usually laymen just throw it around. But that little dotted line, if you can see it, that dashed blue line is the exponential growth curve. You can see we are actually running a little bit above that exponential growth curve. But if that had, and incidentally, in biologic systems, unless a predator comes in or you stop feeding it, that biologic systems grow typically at that exponential curve. In this case, we're the food for coronavirus, and there's no predator. So something had to be done. And you can see that if we were at 1,000 cases there on April 7th, this predicted that within 2 more weeks, we'd be over 4,000 cases. I mean, it was growing that rapidly. We are probably, it says perhaps, I would say definitely, the most community at risk from coronavirus of any city in Connecticut. We're near New York City, not just physically, but our train station had over 30,000 people getting on and off every day. Greenwich may be physically closer, but it does not, believe it or not, have the same connection to New York City that we do. We have a very diverse population, and I think that many of you recognize that minority and lower socioeconomic people were more impacted by this disease for a variety of factors. We have a diverse population in an urban setting. We have many nursing homes and senior care facilities in Stamford, which is particularly hard hit. And although this is kind of strange, although we have UConn expanded its campus here, there's a low proportion of the population that is in local colleges. Or put it this way, in New Haven, when they shut down Yale, you know, 8,000–9,000 students went home. They weren't in the city of New Haven, and they were very young and less susceptible to dying from COVID. So our situation, in my opinion, was the one of the highest risk to the state of Connecticut. To give you a sense, this sort of dark blue line here, or blue bars here, these are 8 different age groups. And you see how this grows to the right. This is distribution of fatalities in Stamford. This is mid-June, late June. And you can see that if you were 70 or older, and particularly 80 or older, and you came down with COVID, that's where people were dying. This does not say you had a 62% chance of dying. That's saying that our fatalities were very much in the older population. And I might add that they often had a lot of comorbidities. The cases, which are that yellow sort of bars, were distributed over all age groups. Many fewer cases reported in less than the 20 age group. We believe that they were not being tested as much. This younger age group probably helped spreading the disease. Then they go visit their grandparents in the nursing home, and their grandparents get very ill and very sick. That was part of the dynamic, particularly lethal to older individuals and with severe comorbidities. So what a ride we've had. Public emergency declared by Governor Lamont. Economy shut down in the state and in Stamford. Schools were closed, implementing distance learning, which I personally believe was, the best second choice, but not a good second choice. We launched Stamford Together, a volunteer program with several of the Board of Representatives and many other organizations. Numerous food drives organized by nonprofits, organizations, and even individual residents. We, in fact, opened the Yukon. We took control of the Yukon dormitories. This wasn't well understood. We actually took control of the Yukon dormitories and opened them for people that need to be isolated for potential COVID patient isolation demand. It turned out that we were able to get control of this in Stamford before it came to that. The hospital, it doesn't say this on here, but the hospital has one ICU unit that normally has about 16 to 18 patients. They opened 3 more, so they had 4 ICU patients. ICU wards, they had capacity for 80, and they were hitting 76 to 78. The National Guard came in and opened up the old wing of the hospital, which has essentially been closed to patients. They were using that for overflow, and that got substantially filled. And if that overflow, they were really coming to the Yukon dorm here, right next to the government center, which we had staffed up ready to go. We've given out over 130,000 free mask giveaways. That's probably wrong. We probably gave closer to 180,000. Some of you might have been to some of those. This was, interestingly enough, back in January, I had told our operations department, I think this thing is coming. I want you to buy supplies. If they sit in our warehouse, it's not the end of the day, but let's buy supplies. So when this erupted and no one could get anything, we actually had some. We didn't have as much as I would have liked, and we had problems too, but we had a little bit of a supply, and that enabled us through funding and through our supplies able to do that. We started our own testing with partners, which I don't believe anybody else even did in the state. We did our frontline responders. We went to the nursing homes and said we would provide testing for all of their employees. We did targeting testing, which I'm going to talk about a little bit more in a moment, which I think was very important. And we even at one point had all city employee tested. You've probably received some of the reverse 911 calls. Almost every one was also done in Spanish with a different list to people that would have probably Spanish-speaking homes, announcing the new restrictions, need for masks and social distancing, and availability of testing. Throughout all of this, we actually didn't shut down any city services. The building department remained open. The parks and the beaches remained open. The ice rink was closed, and for a short few weeks, we had the golf courses closed. We took down the hoops off the basketball courts because we were observing, groups coming together and, clearly violating all the rules playing basketball. But essentially, all city services were retained like during this time period, unlike most of the surrounding communities, which actually shut down city services. We were pushing to increase testing. We had a couple of announcements. We never got to the goals that I was trying to achieve, but we had testing sites established at Cummings Beach, at 2001 Main Street, at Stamford Health, at Stamford Hospital, West Hill, and we started testing, trying to increase the amount of testing. You'll notice there in the chart, it's giving phone numbers. We were saying that if you don't have a primary care physician or can't reach them, or you don't have insurance, you call a number on our website, and we will figure out how to get you a test. If you think you need a test, we'll get you a test, and if we can't get you insurance, we'll pay for it. We've probably done this part of the presentation was read earlier. We've done several thousand tests that were really sponsored by the city. Where at some point in time, we were able to overcome the restrictions of HIPAA. So let me explain. HIPAA is to protect the confidentiality between a patient and the doctor. Well, that would apply to COVID tests. So the Stamford Hospital was doing all sorts of COVID tests, and we had no idea who was testing and who was coming up positive. And legally, we have rights to that information, but HIPAA is well entrenched, and it took us a while to get a legal agreement so that we could see what was going on by combining testing data that we had with testing data that they had, and we could now get the addresses of the people who tested positive. And once we got the addresses of the people testing positive, we could map that onto the major neighborhoods across Stamford. And that's the chart that you see there on the left, with the areas essentially north of the Merritt and Westover being green, which is the lowest rate within Stamford, and those areas that are high density along I-95, west side, south end, east side, being the highest density. And that ratio was almost 5-to-1 between the highest and the lowest in terms of the incidence per 1,000 population. Incidentally, we've taken the nursing homes and senior care facilities out of this data. That's things that we could do once we got this data. And I want to point out something here that has been missed by some people. You'll notice one of our highest density areas is the downtown. We've got a lot of dense apartment buildings in downtown, yet they came up green, essentially as good as North Stamford. It is not just that it's high density, it is the communities of different socioeconomic status and high density together was where we saw the vulnerability. And clearly we had some problems here in Springdale and Glenbrook, and a little bit of the mid-ridges. In a later chart, this is not the most recent chart, this one area north of the Merritt that's light green turned to a dark green. There's a little bit of variation that goes on in terms of statistics here, but you get the picture. We had 5 times as much going on here across the I-95 corridor in the high density, socioeconomically disadvantaged areas. Also, when we got the addresses, we realized that we could actually target individual buildings. So we had a building in Stamford, and we had a prominent community member pass away from coronavirus, and we had identified 15 positive cases in that single building. The numbers for that building would be way off the chart here. And so we organized our testing. Instead of you coming to us, we went to them. And we were holding what I call targeted testing, and usually it was adjacent to facilities where we knew that there was a coronavirus problem. And I tell you, that was an enormous reversal of what was going on. It brought more awareness to other residents. I don't always tell where these occur because there's a little bit of, I don't want to say that this is a building where there's coronavirus, but we got that testing. One of them, May 2nd, Bethel AME, we did with new neighborhoods. We had people that even though we'd set up registration, half of the people were unregistered. We were going door to door, knocking on the doors, trying to get people to come out to get tested. Eventually, it went beyond the neighbor or the buildings, and we realized that we had partners that could reach out to various elements of the community. So we started partnering with the traditionally Black churches. We started partnering with Building One Community. We partnered with the Catholic Church to do St. Mary's and Sacred Heart, where they have a high Latino population. It turns out that the head of the NAACP, his wife is a doctor, and she started running testing programs in conjunction with us, where we were basically making certain that anybody that shows up, we'd be able to get a test. And some of those had little problems here and there, but, and this only goes through July 11th. We ran, I think, a testing program just a week ago. The last 3 tests, almost every case, we were getting 1 to 2 to 3 to 4% positives. The last set of tests, the last 3 times, we got 0%. We're down at a level where it's statistically, you could have some and not see it. But nonetheless, I'm very proud of this. Even though you didn't see it very much in North Stamford, we were making a dent in this problem, and I think it really changed the direction. To the best of our knowledge, there's no other community in the state that was doing this. the State Department of Public Health is now talking to us about what the heck were we doing here, because it looks like something was working, and it was beyond what Yale New Haven was doing or Hartford Health. This is just a little bit of a chart showing the mass distribution. I want to give thanks to those people who are in the CERT. If one of you are in CERT, after this whole thing's over, I'm going to have a party for the CERT people. I mean, they were just everywhere, volunteering again and again and again. And I'll figure out how to pay for a night at, you know, some great restaurant for those guys. They're absolutely terrific. I mean, and then, of course, the ambulance people, the police people, the fire people, the nurses, everything. A lot of people were, I call, pivoting to deal with this emergency. My parking enforcement people, we weren't writing parking tickets. I got them to agree to come over and do the enforcement of, to check out the parks and make certain the parks weren't getting out of control. And these are places where we had COVID distribution and mass distributions throughout the city. I remember going to, you know, many of these, I just show up and see how things were going, and a few of them, we just completely ran out of masks, you know, 2/3 of the way through the time. This is what that chart looked like on April 7th with that predicted exponential curve. This is what it's looked like as of the most recent piece of data. All of this data has been gathered off the publicly available website that the state is using. That's the April 7th curve. As you can see, what I told you before, we would have surpassed 4,000 cases by April 14th. We are still below 4,000 cases. This is the definition of flattening the curve. We got off the exponential, and we started, you know, still going up linearly, and finally in early May, we began to really bend that curve over. We are still getting cases per day. This chart on the left is new cases per day. You can see these enormous spikes going on here. That dotted blue line is, in fact, the 7-day moving average, because there's little reporting anomalies about when stuff gets reported. The 7-day moving average is probably better than looking at individual days. But as you can see here, since mid-May, except for this, which we think is a reporting anomaly, we basically have been running about 5 cases a day, some days running down to 3 or 4 cases a day. And there's been a little bit of a pop right here to 10 cases a day. And I'm going to come back to that on the next slide. It seems like it may have dropped back down again to the 4 cases a day. But that little thing here you see at the end is a little pop that we're watching very closely right now. And I'll explain a bit more about that on the next page. Fatalities. Until we had 1 fatality in early September, but essentially we were running 5, 6, 7 fatalities per day. We haven't, other than that 1 fatality, we haven't had a fatality since early July. And again, sometimes there's little reporting changes. You see these negative numbers. That's because somebody died at Stamford Hospital, but they came from Wilton, and they're correcting that. So in any event, I'm very happy that the fatality rate has dropped to essentially 0 for the last couple of months. This is what I was talking about before. You all received a reverse 911 call, I think it was the 1st of September. Essentially, the state, in conjunction with Yale University, is testing our wastewater at the WPCA. This idea of testing wastewater for epidemics has been used previously, and I think for decades. I think it's been used. I know it's been used in Africa in their wastewater to see if what's going on. They've even used it sometimes to test how broadly vaccines are being introduced in various communities. I think it's been used in the United States before. But now it's being applied to coronavirus. I don't know who thought this up, but basically Yale started testing it in New Haven a couple months earlier, and then expanded it to a number, not all, but a number of the wastewater treatment plants. And this orange line here is the concentration of virus RNA per milliliter in the wastewater. Now, that's not the virus. It is the virus gets broken down, and there's little strands of RNA that can't do anything, so it's not infectious, but they can still detect that stuff in the wastewater. These levels here in early August are right down at the level of the detection. It's as low as it can be, and it's at the level of detection. But here, just a little bit of a gentle rise, but then right near the end of August, this came up. That was the most recent data. I was actually on vacation in the White Mountains of New Hampshire. Not many places you can go on vacation these days, but keeping socially distanced in the White Mountains. And I got aware of this on Friday at noon, and by Friday at 4 o'clock, we had a reverse 911 call on this. This was thought to be a predictor of future cases, and it looked like we were headed for a spike. I think you all know that Danbury has had a spike, and they haven't come off it completely yet. There's another community name I can't remember who's had a spike, and I'm nervous. I will tell you I am nervous. I'm concerned that too many people are relaxing a little bit too much. And you walk down Bedford Street on a Friday night, and technically they might be following the rules, but I'm a little bit concerned about it. In any event, that connects to this chart on the left where I was mentioning we then had a little bit of a pop about 10 days later. The word was we didn't have a pop 7 days later. We had a tiny little pop 10 days later, and it looks like it may have dropped down, and consistent with that, shortly after I made this announcement, we had these numbers drift back down again. So this is the updated data from the WPCA testing, which tells us at least right now, it doesn't predict a huge spike. You'll notice those levels are a little bit higher than they were at the beginning of August. That highest point on the left and right plots, they were projecting 25 new cases a day in Stamford and Darien. We're not getting that, and we didn't get that, but we did get a little bit of a rise, and maybe it's just a little bit of the data is imperfect. I'd like to think that people paid attention to that and backed off a little bit, and we tamped down a possible spike before it happened. Incidentally, and this is kind of off to the side, our case rate per day in Stamford, if we get exactly the same number of new cases for students and staff in the schools, even if the schools are not spreading anything, there's zero spread in the schools, there will still be cases that come into the schools and will get detected. We should expect to get 3 to 5 school cases a week, even if the schools are perfect. It's hard to imagine it would be less than 1 school a week. And if it gets to be 10 schools a week, then we probably have bigger problems that are either spreading in the schools or we've got a bigger problem in Stamford. But these cases that we've seen in the schools, they are concerning, and let's not say they're not, but we are 99% certain that all of those cases came into the schools. We have not seen any further spread, but it's still too early. But they're exactly about the number that I personally had predicted, that it would be somewhere between 3 and 5 per week. We've had 4 in a week. But we're going to have to continue to watch that very carefully. And if we start getting spikes in the community, we can't have that many cases coming into the schools. And of course, if the schools themselves are having problems, even though they're doing everything they can possibly do to limit the risks within the schools and on the buses, I might add. So moving to a new issue, what does that mean in terms of the economy? We actually have one of the most robust small business environments in the state. It is not just the hair salons and the nail salons. It is that we have a more vibrant entertainment community. And whether you're talking about the Palace Theater or whether you're talking about our wonderful little curtain call up there at Sterling Farms, or whether you're talking about the restaurants in Hope Street, in South End, downtown, West Side, wherever it is. We've got a very robust restaurant and a very heavy dependence upon activities in hotels. They were all shut down. And since they're all shut down, a lot of people, particularly at the lower income scale, were being let go. This is the historic weekly claims for unemployment that often happen. You know, this is the average that you typically get. During COVID, the weekly claims for unemployment jumped in Stamford. This is Stamford, from 0.13% to 1.54%, over a tenfold increase. We still don't have the unemployment data, and things are moving rapidly, but this is a clue about the challenges that we were facing from the economy. When you look at the overall, because we have a more robust small, restaurant entertainment sector, you would expect us to be hit harder than the rest of the state. They don't have this sort of activity in Bridgeport. They don't have it, so therefore they're not going to get hit as hard. Even in the surrounding communities, even though there's a lot of great restaurants in Greenwich, they don't have the same level of activity as we do. This is our growth of the COVID period versus an historic average. I said it was over 10 times, about 11. This is Metro Fairfield County. That's basically something that I look at. That's Greenwich to Fairfield and adding in New Canaan and Wilton. These are areas that are easily served by Metro North and go to New York City. That's what I call Metro. They basically went up over 100%, so it more than doubled, but nowhere close to what Stamford experienced. And the state, and incidentally, Norwalk is a big component of that, of the increase. And the state went up six-fold, 6 to 7-fold, nowhere close. So in March, our weekly unemployment claims were rising much faster here because we had a stronger economy that was impacted by the shutdown than Fairfield County or the rest of the state. Clearly a problem. Fortunately, the CARES Act and other stuff that was passed by Congress provided money to, I think it was like $1,500 for people with certain income levels and their income taxes, plus was providing supplements for unemployment. And that actually, in my opinion, helped keep our economy afloat during this time period. There have been some concerns that 600 was so much it was hard to get people back off unemployment in some cases. But this will move on to the next topic. There has been no funding for cities or counties, and our counties don't matter, but in many states they do, and states. There's been no funding other than direct funding for COVID expenses, and we've been using that in Stamford. So when it came to the Stamford's budget, the Board of Finance said, given the economic difficulties, we're going to have zero increase in the tax rate. Guys, that's incredibly hard, and it's incredibly hard for two reasons. One is inflation. There's no tax increase for inflation. The other reason is something that I've yelped about and whined about with you and others is our unfunded liabilities for pensions and retiree health care. This year, that obligation went up 10 or 11%, and that's 10% of our budget. That's a 1% tax increase just to fund stuff that was done 20, 30, 40, 50 years ago. And it's continuing to hit us every single year. So if we're going to fund those unfunded mandates, which we need to do, and we have inflation, and then you have a flat mill rate, no increase in the tax rate, it means something's got to give. And what gives is, in fact, on the city operations side, we actually have less money for city operations this year than we had last year. The financial obligations, that's really pensions. That was increasing. We assumed healthcare savings there, or I should say the Board of Finance assumed healthcare savings that we have not yet achieved because of challenges of getting the unions to agree. The Board of Ed had a very tiny increase. This savings in ed support is that we were getting out of the Westover lease where we leased Westover. And while that's a big savings, you'll notice that it's really not a big component of the budget. We plan to use the rainy day fund to the tune of $18 million. We are facing an economic crisis, and I think we're going to manage through it, but it's a lot of problems. This says we'll finish fiscal 1920 with a $5 million surplus. That's not correct. We're going to do much better than that. Believe it or not, in the middle of all this COVID, where we're keeping city services going, please don't read this the long way. We gained a lot of flexibility to do things that I couldn't normally do. And as a result, we started saving more money, even though we're keeping services open. We actually, when it said we were projecting a $5 million surplus, we anticipated the Board of Ed was going to lose $2 million this last year because of the coronavirus, the shutdown of the schools. The cost for school cafeterias went way down, even though they were providing meals. The cost of transportation went way down, and basically some other expenses went down. The schools went from a minus $2 million deficit, had an $8 million positive swing, so that we anticipate they'll come in about plus $6 million. So we had a very significant surplus from last year. That surplus isn't going to make much difference this coming year. And we can't use the surplus to fund for operating. And for those of you who appreciate, I'm one who keeps capital expenses separate from operating. So we've got a significant challenge. City operations budget, I don't mean operations, the city side is below prior year. Health savings, it is now impossible to achieve the savings that are planned for, and the Board of Ed is struggling with a limited increase there. The Board of Ed has received funding from the state to help with the COVID opening of multiple millions of dollars. So they're in a little bit better shape than these numbers would suggest. What I was talking about before is, as you probably know, Congress has not passed an additional CARES Act after the first one. And this seems to be stuck between the Republicans and the Democrats. The Democrats want more, and it appears that a big part of this is the Republicans do not want to fund cities, counties, and states for the challenges that they're facing, such as Stamford. And the bill that the House passed actually would have given Stamford $45 million. That'll never happen for a lot of different reasons, but that's now stuck, and cannot get an agreement on that. And so while the state helped out the Board of Ed, the city's getting no support. I am hopeful that, and I'm sorry this will sound a little political, I am hopeful with a change in administration and a new Congress that by February or March there will be a support bill that will help counties, states, and cities, and the city of Stamford, by at that point, will be able to deal with some of these challenges that we're dealing with that otherwise are going to leave us not only using the rainy day fund, but in a deficit. Now, having said that, there is a little bit more to this. Our budget this year, and it's never been like this before, at least not in the 35, 40 years that I've been involved in this. You can divide it into two parts. One part is what I call deferred taxes. It's called number 2 here. Deferred taxes are essentially, the Board of Finance said, instead of collecting 99% of our taxes, we'll collect 93.9%. Well, if you lose 5% of your tax collection, it's going to cost you about $30 million in cash. The difference is that we fully anticipate that we will get that in the future. One way or another, we will get that money, even though it may not get it this fiscal year, we'll get it next fiscal year. And those deferred taxes, I'm willing to borrow or use the rainy day fund to support that shortfall in cash. And so while that's significant and causes a lot of people to have their hair fall out, I'm not worried about that. I can handle that. And so far, the collection rate has been much better than the Board of Finance predicted. So we should be able to deal with that issue effectively. And so hopefully we won't go as much of a problem, but I can deal with that one. The other one is harder, and that is we've assumed cutbacks in revenues and that we'll never get back. So Fees that we charge are running now below they were prior year. We decided that we weren't going to collect all the parking revenue and the parking fines. The development fees are slower than they were a year ago. They're still good. They're still surprisingly good, but nonetheless, we're never going to get that back in any time frame. And on top of that, although the state in their budget says that they're going to continue to fund everybody for this year, in the 6 years I've been mayor, 5 of the 6 years, the state has not funded what they say they were going to. And to be a little cynical, after the election is over in November and all the state senators and representatives come back, I think they're going to be looking at a state budget that's dependent upon income tax and sales tax. And the state's going to be in deep red water. And as a result, if they behave like they have in the past, we won't get all the funding we've been promised. We've put in assumptions for that, but that's the real challenge. So what do you do with that? The Board of Finance said in a recession, we shouldn't be increasing salaries. I think that's a fair statement. I actually agree with that. In April, my cabinet and me and the other pay plan staff, these are the non-unionized staff in the city, which is only 32 employees out of 1,500, took a voluntary pay reduction to the salary rates. Not only did we not take a pay raise, we took a reduction back to 2018 and agreed to forego the annual raise. 3 city unions, the UAW, the MAA, and the nurses. The MAA is the managers and supervisors. The nurses are in the school public health nurse, the school nurses, etc. And the UAW, which is, think of them as the support staff, the secretarial support staff. That's not a full thing, but those 3 unions agreed to a wage freeze for last year and what we call a reopener. We'll rediscuss our wages for this year in exchange for no layoff clause. And so we haven't laid any of those people off, but we're not paying them a wage increase. The problem is that other city unions, the police, the fire, the IUOE, which is basically the public works department that picks up the trash and fixes the roads, the custodians in the school, these are the city unions. We're in negotiations, but we have not been able to have them agree to anything. You know, they're still saying that they want salary increases even during a recession. And I think you know that all of the Board of Ed all the Board of Ed unions, by which I mean the paraeducators, the administrators, and particularly the teachers. And the teachers are by themselves are almost half the salaries of the city. They have not agreed to any reduction. And so we are considering layoffs. It is hard to lay off police and fire without actually costing us money, but we have laid off people in public works. That's resulted in a reduction in our ability to pick up trash in the parks. It means that potholes aren't going to be filled as quickly. It means that the recycling center is open only 2 days a week, and we've canceled some things that we might have done up at Schofield Town. The recent storm from Isaias, we would have normally gone out, and even though it would have cost us more money, we would have gone out and done a citywide pickup. I don't have the manpower and I don't have the budget. In that regard, FEMA may reimburse 75% of that cost. I'm still waiting because it's not 90% certain that they'll reimburse. As of Tuesday, Fairfield County only had about 50% of total expenses from Isaias in order to get that emergency funding from FEMA. If we get that emergency funding from FEMA, I'm going to hire back some of those workers. We'll pay 25%, they'll pay 75%, and we'll do a citywide pickup. But, you know, you've already forgotten about Isaias. It's that long, but I don't have the manpower and I don't have the budget. And that's been a real challenge, and I know people have been disappointed. The city of Stamford, we'd managed to get ourselves to the point where we had the best recycling rate of any major city in the state. And if you're closing if you're only operating the recycling center 2 days a week and not picking up the trash in as expeditiously as we were before, I'm concerned that that's going to slip. That is the big challenge. I know we're going to get through this, but I don't want to use the rainy day fund. If somebody, oh, use the rainy day fund, raise the rainy day fund. I don't have it in this chart, but our best predictions are that this recession will last for 2 years. And if we can't get salary freezes, we're going to have a massive tax increase next year, or we're going to use up all the rainy day fund and be with nothing. So we're trying to manage over that 2 to 3 time period. And we're doing okay, but I am disappointed because I really believe that we should try to maintain our services, even some that I don't necessarily buy into, but I want to maintain them as we deal with other challenges in the city. There's some other, these things I think I don't need to spend a lot of time. All the uncertainties about the economy, uncertainties about our collection rate, uncertainties about what the state is going to fund us. Is there going to be an act supporting municipalities, et cetera? We have seen an increase in residential housing demand, and there is an increase there. We're picking up a little bit of conveyance tax from that, but there has been a very minor interest in the commercial side. There's some interest in the commercial side, but it isn't as much as the residential, and we don't know how that's going to last over the next 2 or 3 years. And we have the potential for a second wave of infections, which could really make a lot of changes here. And as I've already said, this is the area where we've had some cutbacks in terms of pickup of garbage and recycling, et cetera. These service reductions have happened. I felt that I cannot make service reductions in the police department. I will share with you that I recently saw a study that after things like pandemics, like in 2000 or 1918 in that pandemic, there's been a lot of social unrest after that. We've seen the same thing in this country. What happened to George Floyd up in Minneapolis, I think was like the fuse, but I think the dynamite was already there. And we've seen, I think, 11 or 12 protest marches, and all but one. Some of them a little bit disrupted, but they've all been peaceful. We had the camp out in Latham, which we were able to diffuse peacefully. We did have some of the people really, they were going down Bedford Street and going into the restaurants and yelling at the patrons and advocating something more aggressive. And we had the scuffle there that actually injured a couple of the officers. But in that plus, the nationwide is seeing a rise in violent crime. I've been reluctant to cut back on the police given that environment. And I don't believe in defund the police. I think you have seen, you saw it today in the paper and yesterday, we're expanding the role of the police commission to take a broader role. I think is the right thing. And I have the chief and the police union on board for doing that. But we're working in some challenging times here. The government center, people ask, the government center remains officially closed to visitors except by appointments as necessary. There are a couple of exceptions if you need to go to the credit union, if you need to go to the cashiering or pay your taxes. We actually moved the tax collection from the 6th floor down to the 1st floor, and I reorganized in order to change our management structure, which is something that I've been thinking about earlier. I think in the long run, it'll actually improve those people, reduce the number of people standing in line, and actually save us a little bit of money over the long run. We are saying the employees at the government center should continue to work remotely if possible. But if they want to come in, and particularly if their supervisor or manager needs them to come in, they can come in. But we are continuing to have boards, commissions, and work meetings conducted by Zoom. You have to wear a mask in the government center. There can only be 4 people in an elevator. I've got signs in all the bathrooms. The senior center is still not having activities. Maybe we'll see what we can do in November after Thanksgiving. I have had the Board of Education says, we want to have our meetings. And what I said, if you've only got 9 or 10 people and a couple of guests in the boardroom, you can keep yourself socially distanced. You may do that, but I'm not going to let visitors in. They're going to have to be Zoom. And now you're going to have new issues going on. So I think they've decided that, I don't think they formally decided, but I think they're going to continue to hold Zoom meetings as they have here since July or whatever it is. There are strains going on, particularly in our IT area, as you would expect, with what's going on in the schools and increasing bandwidth capacity to both the city and everybody else and all the other stuff that goes with that. But so far, it seems to be working, and we've been able to get our work done. As simple as that. I am also increasing the enforcement into the restaurants and the retail establishments to ensure they're following the rules. It's not a big status. Basically, we're going to have somebody checking on them. And the health department, kind of checks the kitchen. They normally don't check this sort of stuff. And right now, when there's a problem in the schools, they got to immediately go into contact tracing. So the health department is spending its time dealing with contact tracing to make certain we get everybody isolated that might be exposed in the school, which means that we may not have the same level of inspections going on that we normally would. Well, that's a lot of stuff that I've thrown at you. May 20th, we had phase 1, the museums, the offices, the restaurants, and retails. We provided the guidelines to businesses. We were actually shutting down and limiting things before the state did, but not very much, like we were maybe a week ahead of them. Phase 2 on June 17th, personal services, gym and athletic facilities, library, limited outdoor events. You can see here what we've done in the back of Bedford Street. They call this the Bedford Street Piazza. I don't know, dining on asphalt may not be as good as whatever else you can do, but I know it's helping, and you can see these are spaced apart. We're trying to get the economy going again to the benefit of the small businesses as well as the community. The originally phase 3, the governor has suspended indefinitely. Bars have to remain closed, etc. And I don't know if that's going to be released. But basically in Stamford, was it all come about, we've had a better reopening, and from what I understand in terms of our restaurants and nail salons and everything else. I have to give a lot of credit to a lot of different people to help making this happen. I am nervous. You want to know if I'm nervous? I'm nervous. I see most people observing masks. We haven't had a lot of fights in this community about that. But, sometimes I look at some of those restaurants, not here in the piazza, but on the other side, and the tables are maybe just a few inches too close together, but it's not 5 or 6 people around the table, it's 10 or 12, and I'm a little nervous. So we're kind of stepping that up a little bit. In any event, that's the status of the city. I've left so many things out, even though I've gone long as usual, for which I apologize. But that's what we've done, and I'm happy to take a few questions before I leave. And my secretary is telling me I'm already late for the next thing, I'm answering that question, but I'm back.
Thank you.
So thank you.
Raise your hand, please, guys, because time and the number of questions. Don't make statements. Ask a direct question of the mayor so that he can give a response. Joe Raccanello first.
Yes, good morning. I had a question related to the ballot drop boxes in the city. And as everyone knows, there's been a lot of discussion lately on voting. And specifically, the question relates to the security on these ballot drop boxes. What kind of security do they have currently? Do they have cameras? Do they have a security guard there? Is the Stamford Police Department going to periodically monitor the activity there? Because of all this activity, can you talk a little bit about the security related to voting on these ballot drop boxes?
Yes, in the government center garage, we have cameras. So if there's some, I'll call it mischievous or just blatant illegal activity and we detect it, we're going to have the cameras there. I don't know. I think we've got a ballot box at the library. I don't know if they have a camera there. Actually, it gives me an opportunity to talk a little bit about what's happening in voting. You may have seen in the paper I was whining about how Stamford was treated, but I have some good things to say. As you know, the governor has used the emergency status to basically say we're going to really push absentee ballot. Previously, Connecticut had some of the most restrictive laws when it comes to absentee balloting, and I take objection to that because many states have been using lots of absentee ballot, and we have sort of artificial restrictions, in my opinion. But in this case, it says we're going to let people vote for absentee ballot. The state Secretary of State said in order to make it equal, this isn't their words, these are my words. In order to make it equal, they will send out absentee ballot applications, not ballots, applications to every registered resident throughout the state. So it doesn't really matter whether you're in Hartford or in Stamford or in Wallingford or New Bridgewater, or whatever it is, you'll all get an application if you're registered. Those applications get mailed back to the local community, and I may get this not right, but I really like, and they were paying for the postage and all that, but to me, the big thing is it's going to be an equal playing field in terms of absentee ballots. What you put in that box, ultimately the ballots, you're concerned, and you didn't say this exactly, you're concerned about fraud. What happens is that when the ballots come back, they check those ballots to make certain that they don't have two ballots from the same individuals. And when you get to the polling location, they'll check to see if somebody has already been recorded as balloted a absentee ballot and they're trying to vote. We actually had a case here a few years ago, and I don't know how that's ultimately been resolved, where somebody said that they hadn't voted by absentee, but we had a record that they had. And that inconsistency gave rise to an investigation, and they determined that there were a handful of votes that may not have followed proper procedure. So I guess what I'm trying to say to you is that the check to avoid fraud doesn't happen by having a guard at the ballot. It happens by checking that, first of all, that person actually has voted once and only once. And incidentally, when you have that many absentee ballots, that's time consuming. So there's an expense associated with that. And previously, you couldn't even open the absentee ballots until the day of the election, and I don't know if they've changed that, but basically, if you have lots and lots of absentee ballots and you are checking additional things to make certain they're valid, you're not going to get the result Tuesday night. It's going to take a little bit of time, and people will be claiming about that. But that's just the nature of logistics. So I guess what I'm trying to tell you is I'm not concerned about fraud. I will check, given that what you've said, I will check with the registrar of voters and town clerk, and I think they're on top of that. The issue that I had problems with the state is that they said that they would reimburse all the communities for their COVID-related expenses connected with the elections. And I took that, and then they announced that Stamford would get $12,000 or $17,000 for the primary. Wait a minute. We're at the center of the epicenter of risk. We have diverse polling locations. I mean, Bridgeport has polling locations that are all in downtown locations, and some of the other communities are all really rural. We got both, and they're different. We have more votes in Stamford than any other community in the state. We've got 25% more votes than New Haven, which is the closest to us. And none of that was considered. And, it's just sort of a joke that they were giving us, $17,000 when our registrars and town clerk, and I think they overspent. They needed $250,000. This was what the state was doing. They've now come back and said, we'll give you $90,000 for the general election. And I'm saying, you're giving more money to communities that have simpler problems, that weren't at the center of the pandemic and have fewer votes than we are. We're getting cheated again. And this is an ongoing problem. Hartford is Hartford-centric. It thinks about Hartford. It thinks about either the rural communities, or it thinks rural suburban communities, or it thinks about the big poor cities, which there are Hartford and New Haven and Bridgeport and Waterbury. and Stamford gets left out of the mix. And when they devise some sort of formula, we sort of end up with a short end of the stick. It is not a big deal in this case. I think we're shorted, by the way I would look at it, by maybe $30,000. Listen, I'm worried about hundreds of thousands of dollars. But to your direct question, I do not believe that we're going to have a significant fraud problem. If town clerks and registrars in some communities aren't paying close attention to this, there is that potential for fraud. I don't think it will happen because I think everybody's going to be on their toes on this thing. Either the Republican register is going to be on their toes or the Democratic register is going to be on their toes. But there may be an exception. And we all know, we've heard about challenges in Bridgeport before. I have a feeling, you just seen news about Bridgeport here in the last couple of weeks. I have a feeling we're going to have some challenges again, but I don't think they'll happen in Stamford, and I don't think they'll happen in much of the state. I hope I'm right, and I certainly will work on my side to make it right.
Ira.
John Zelinski.
Two related questions. It's all part of the same thing. Number one, can you say anything about the future of the town center? But of more immediate concern, how much is the loss of sales tax from the loss of retail in the town center and Lord & Taylor closing and all that happening? How much is that affecting the city's income?
Here's a surprise answer. Doesn't affect our income very much at all. We don't get any of the sales. We don't get any of the sales tax. Oh, I'm back to the whining mayor. The state doesn't help. We don't get the income tax. We don't get the sales tax. It costs us more to issue a moving violation on a car than we get back from the state. You'll get a $200 fine and we'll get 20 bucks. It costs us more than that to actually issue it. They take the hotel tax. I mean, basically, they take just about everything and they don't give us much back. However, there are three things. One is it reduces the retail shopping opportunities. Hey, listen, I go to Lord & Taylor. I probably bought this tie there. I would prefer that it had been able to stay open. And in the long run, if Lord & Taylor and other retail establishments can't keep their head afloat, and I think it has more to do with Amazon in the long run than it has to do with coronavirus, but you put those two things together and it gets you right now. We're going to see that the value of that real estate drops. And when there is a revaluation, then the Lord & Taylor property won't get as high a property taxes. The mall won't get as high as property taxes. If we don't collect as much from them, then guess what? We got to collect more from me and you because our property values actually will hopefully stay steady. And of course, the last thing is there's jobs there. And Stamford has actually a shortage of workforce for certain jobs, particularly in the science, technology, engineering, math, the big businesses that come here. And the reality is they got a shortage of that, but we have a surplus of people that do the retail jobs, that do the restaurant jobs, that do the security jobs, and do the landscaping jobs. And the loss of the mall and the loss of Lord & Taylor means people that are at the lower end of the income spectrum are going to lose their jobs, and there's not much of a replacement. With respect specifically to the mall, it is halfway owned by UBS, I think, and halfway owned by Taubman. They put it up for sale. We know that they received a proposal. That proposer is talking to the city of Stamford about what's going on with regard to us. We're not in the driver's seat because we don't own the mall. I'm going to give you a complication on that in just a second. That's an enormous complication. But I believe that Taubman and UBS were unhappy with the bid, or there was something that came up in due diligence, so I think they're going out again a second time. The challenge with the mall is that when it was created back 40 years ago or 45 years ago, they've got the most convoluted, crazy-ass agreement that has to do with the parking on there. So the city owns the parking, but we don't own the mall. And I'm sorry, how do you deal with that? The mall structurally is hard to adapt, but we own the top deck for parking and the bottom decks for parking. And the deal is that the mall collects the fees in the mall, but we collect the fines. I mean, it's just a crazy ass deal. And what we call the helix, which is the circular ramp that comes up on the side of the mall near Veterans Park and Old Town Hall, that's technically owned by the URC. It's not actually owned by the city. It's owned by the Urban Redevelopment Corporation, which you can see is the city. And whoever buys this, they're probably going to want to buy that ramp. Well, how do you value a ramp to a parking thing that they don't need? And I can't, no matter what we do, they'll say it's too much, and members of our boards will say it's not enough. So it's a challenge. I think the mall will be marketed at some point in time, but coronavirus has thrown a real wrench in this. The owners of Lord & Taylor actually met with our economic development director and our land use director to understand what was eligible as of right under zoning, I think either late last week or this week. So there are some discussions there. My goal is not to let them have anything they want so they make as much money as they can, but to deal fairly with those property owners and deal fairly with the other residents in the area of the Lord & Taylor facility. I don't believe that we can put our thumb in it and force it to be a Bloomingdale's or force it to be a Macy's. I think that's would go wrong. But we'll see how it will end up being readapted at some point. It is possible.
John
It's possible
Zielinski,
they'll come back and say, let's go for housing. That's a possibility.
John Zielinski, are you still there?
Yes, thank you very much. Good morning, Mayor Martin. Good morning, Mayor Martin. I hope you're well and healthy. There's an article on the front page of the Advocate this morning regarding masks. It's quoting that the governor issued a executive order for a $100 fine requested by many municipal leaders, and you are quoted as you weren't one of them. Also in the article, and I'm quoting, that Mayor Martin said civil citation officer Frank Fidelity will check retail stores and restaurants, including at night and on weekends, to ensure compliance with the mask requirement. Two-part question. One, why were you not one of the municipal leaders to go along and ask for a mask and the fine? And secondly, that seems to be an enormous task for one individual, Frank Fideli, to do all those things that was mentioned in the Advocate. I recall a couple of years ago, the Board of Reps at your request.
Let the mayor answer. John,
I didn't finish answer the question yet, Joe. Many years ago, the Board of Reps at your request appointed 10 citation officers. Cannot they be used for some of the work that Mr. Fideli would be doing, Mayor? Thank you very much for your answers.
So I didn't request it to get to that narrow one because I was on meetings with Western Council of Governments where there are 17 other first selectmen and mayors, and I was hearing some other stuff, and this was, and I hate to say this, and I don't mean to make this politically confrontational, but what I was really hearing was, as you might expect, some people were confused by the orders coming from the state, and there was complexities. Of course, we're making dramatic changes. Of course, there's some confusion. For our part, we mostly understood it, and most of the things they were doing were things that we were working on and largely planning to do much the same thing as the orders that came down. If the orders didn't come down, then we were going to do it. So we weren't surprised by any of that, and we didn't really have, in my opinion, an enormous problem. What we had was some first selectmen that, listen, I whine about the state not supporting this financially. We had first selectmen in small little communities whining and complaining about this and that, and we don't know, and blah, blah, blah. And it became more of a political attack on the state. And I was asking the question here, you know, what can we do in this regard? But I don't want to put the challenge. I want to use fines as sort of a last resort. We can do anything else, that would be great. The other part of this, which was not reported in the paper, is that those fines will go to the state. Well, I can guarantee you that issuing a fine for mask wearing is going to take some time, and some people are going to object to that. And if you think about it, it may seem like a lot of money for not wearing a mask, and you might be right, but it's going to cost us more than $100 to enforce it, and the state's going to take the money. I'm not in love with doing fines. The restaurants and the businesses, most of them have been good. I've heard, you know, but if we hear of restaurants or businesses that are creating a problem, Frank's supposed to go out there. You are correct. It would be better if we had more, but I still have the health department. My problem is the health department's also got to deal with contact tracing. I still have the police department, but the police department's working overtime dealing with protests and marches. And to the point that you made about, I had actually had several civil citation officers. All of those civil citation officers were objected to being reappointed unless they got additional pay. And that was a union issue, and it's on the agenda of things that I would like, but essentially I was going to reappoint them, and the union objected. Frank did not, and we've changed his job description so that he's no longer doing cashiering and permitting. He is solely dedicated to this. And you may be right. It may be that we need more, and if so, we will direct the police or the health department to become more involved in this.
Okay,
Thank you, Mayor.
Howie,
Keep up the great work.
Thank you.
Howie is the last question. Howie.
Morning, Mr. Mayor. Thank you for your presentation. I understand money-wise why the city couldn't go around to everyone's house and pick up their logs and branches and stuff from the storm. But are you planning, and is it in the budget already for a leaf pickup?
Yes.
Thank
It's there, but I should tell you, the leaf pickup is operationally a nightmare every year. Every year, the situation on the ground is different. And this year, I have smaller staff. So not only do I have smaller staff, but some of the equipment that we had bought 30 years ago that we only used for leaf pickup is broken down. And so we don't have all the same equipment. We've got it in the budget to rent it, but we don't know yet that we can rent it all. So I'm going to tell you that we have leaf pickup. It's in the budget. I'll be honest. My strategy is to maintain services while we deal with other issues. So I don't want to cut leaf pickup because it's counter to my strategy. However, we're the only community in the state that's doing this. Nobody is doing what we're doing, and it costs us a lot of money. It's not environmentally sound. It's an operational nightmare. And this year, unfortunately, I predict it's going to be worse, but we're going to pick them up and we're going to do the very best we can. And with a little bit of luck, we'll do well. I've already seen leaf piles down in Japan. So it's coming about, but we're going to do that. That reminded me of one other point that I wanted to share with you. Maybe it'll come before Joe cuts me off.
All right, I'll give you one more question, and then you can think about it. You know, when these protests first started, one of the big things, there was a group protesting with misinformation about Christopher Columbus, the statue in Columbus Park. What's the status of that? I mean, there's a lot that's come to light where people are misinformed about what he did. So what's the status on the statue?
Well, okay, let me get all my lawyers lined up around me. Here's what's going on. Just so you know, I received well in excess of 100 emails and a few phone calls from people saying, you know, get rid of Columbus. This is a racist person. We shouldn't have him in the government. Oh, let me pull that. Good. Killed it. Most of those emails were what I call form emails, almost identical verbiage, one after another. But, you know, it was well over 100, and we've received more since then. With that firing up, we started getting phone calls on the other side saying, you can't possibly do that. That's a symbol of Italian heritage and blah, blah, blah. And I basically thought that this was entirely the Parks and Rec Commission authority, and the Board of Representatives has the authority. Once the Parks and Rec Commission makes a decision, the Board of Reps has the authority to overrule it. And I basically told the leadership of the committee and the Board of Reps and the president, listen guys, if you want to take it down and you vote to take it down, I'll take it down. You vote, you keep it, or you don't vote, I'll keep it. We subsequently had 2 peaceful protests. No, there's always yelling and screaming, but 2 peaceful protests. You'll notice we put up a barrier around the statue so that we would reduce the chance of vandalism. We had a protest, and my numbers are wrong, but I think there were 100+ people protesting to remove it. And then about 3 hours later, there were, I think, 150 or 175 protesting to keep it. So right now it stands. I'm not like Gannon, who trucked it off in the middle of the night. I was considering it. If we thought we had an active threat, I was going to protect that statue, but I don't think we've had an active threat. We do have private cameras that can see that park and see that statue. I am erecting a blue light emergency pole there. I don't know if I'll get it up by Columbus Day, but I suspect this issue will come up again at Columbus Day. But right now, the statue itself is actually under the initial jurisdiction of the new bureau chief who arrived here, 2 weeks before pandemic started, Jennifer Williams. And I basically told her that unless there is strong resurging sentiment to change the status, I have no interest in fighting that battle. We got a lot of issues to deal with financially and health-wise, and people who believe that things have gone wrong with the police, and I think they're largely mistaken about that. We got a lot of other issues, and while I believe that Italian heritage is very important, I think there's a lot of great figures. I don't think Columbus is the figure that should have been chosen. They don't celebrate Columbus in Italy. So I'm not wedded.
They didn't discover Italy, was there long before that.
True. But I will tell you, the city erected this. It was a gift from UNESCO and the Italian community. We have important Italian-American figures in the city of Stamford who it supported. I don't think that Michael Marchetti wants to change the name of his fine restaurant from Columbus Park to Heritage Park. So I think it should remain there, even though I personally am not a big lover of Columbus. I think this is a false issue. You have a Confederate general that was erected because the Ku Klux Klan convinced somebody in 1915 to erect something to show the importance of that sort of Civil War heritage. I would object to that. I think that needs to come down. But unless this community says it needs to come down, and so far I don't believe they have, I'm going to try to protect that statue as best I can.
Thank you. Okay, unless you came up with what you wanted to say, we've run over the time, but it was a tremendously...
That's one thing that has remained the same throughout the coronavirus. I will run over on my presentations, Joe.
We figured that. That's why we allowed extra time. But Mr. Mayor, again, thank you so much for giving your time today. And whatever lunch you have, just enjoy it.
I'm going to have 2 hamburgers the next time you're down at Cove Island. Oh, incidentally, you know, I've biked to Cove Island from here. Somebody stole my bike.
That's
Oh,
terrible.
somebody was asking about the ballot box. We have cameras in there. You know, it turned out that some of the cameras aren't working. The camera that pointed to where my bike had been parked for 5 years was not working. So we don't know. We know who left the government center, but trying to examine every person that drove in and out of the government center. So I've lost my bike. And guess what? You can't buy a replacement bike right now because the bike industry is one that's done very well.
Okay. And again, we apologize that we couldn't give our day of service this year, but you know, in spite of the pandemic, the group that's going out there, we were in 65 to 90 plus year olds, so we were at great risk, but we'll be back.
Listen, volunteering is great. I thank all those that do. Keep yourself and your family safe first. You can't help anybody if you're yourself stuck in the hospital.
That's true. Again, thank you so much for being with us today, as always.
Thank you
We'll see
guys.
in
Continue to do
January.
great work.
We'll see you in January.
Bye.
Bye.
Okay. Guys, also, board meeting at 1 o'clock, so we'll see you back board members back in an hour. And Jerry, I hope, Jerry Krantz, that you'll be able to join us for a brief discussion.
Okay,
Okay, meeting is
want to end it.
adjourned.